There is confusion this morning over who will be able to get the updated COVID shot. Under new FDA guidelines, not everyone qualifies for a vaccination. 16 states are still waiting for guidance. CBS News medical contributor Dr. Céline Gounder is editor-at-large for public health at KFF Health News, and she joins us this morning here on set. Good morning.
Good morning.
All right, so let's start with just the lay of the land. What's happening here, and what are these new guidelines?
So I do want to clarify, it's not that the FDA approval of this season's vaccination means that people are not eligible. So it's approved for people 65 and over, and it is approved for people 6 months to 64 years of age who have at least one risk factor for severe COVID. However, you can still get the vaccination off-label if you are between the ages of 6 months and 64 with a doctor's prescription, conversation with your doctor, that sort of thing. So again, even our writers here are confused about what is going on here, and it is a very confusing situation.
And I think that's a really important point to just sort of nail home, that go talk to your doctor if you still want to get this shot. You've called this sort of a hodgepodge when it comes to the rollout. What could be the impact here?
Well, part of the reason for the hodgepodge is because you have 34 states that can already start vaccinating on the basis of the FDA approval. In the other 16 states, there are various different regulations, boards of pharmacies that have different ways of doing things. And in many of those, they're waiting for the CDC to weigh in addition to the FDA. The CDC is going to weigh in theory, September 18th and 19th. That's when their next vaccine advisory committee is supposed to take place. However, now you have Senator Cassidy saying that anything that comes out of this current CDC, given the chaos and frankly, poor leadership of the administration, anything that comes out of there is to be questioned. And he's calling for hearings to speak to Secretary Kennedy, the former CDC director, and others to clarify the situation.
Real quick, there was an op-ed published this morning that includes the thoughts of 9 former CDC directors who served Republicans and Democrats, raising big concerns about Secretary Robert Kennedy's oversight of Department of Health and Human Services and CDC more specifically.
Yeah, they're raising a very big red flag. And I'm just going to read a couple lines here. Health and Human Services Secretary Kennedy has done to the CDC and our nation's public health over the last several months is unlike anything we have ever seen at the agency and unlike anything our country has ever experienced. And I think it's really important to say this is not about their partisan leanings. They have served under both Republicans and Democrats. And what they're trying to say is, look, Congress, you guys need to step in and exercise your authority over HHS and call that hearing with Secretary Kennedy.
Dr. Céline Gounder, thank you so much for that information.